Today we'll be hearing from Malawi and Zambia on immunization services, and we would like to hear from them how during this COVID pandemic, how have they been coping and what lessons have they learned in the process, and are there any specific strategies that they've put in place to mitigate any of these challenges that they've been experiencing following the crisis. So to lead us in our discussion today, we have Mrs. Gift Aniom from Nigeria. She'll be the moderator for today. Gift Aniom is a public health expert with over a decade of experience in immunization, HIV and AIDS, malaria, as well as TB. And she's got technical expertise in monitoring and evaluation, programming, as well as research. Now, between 2012 and 2015, Gift worked as an M&D specialist for the Global Fund and 2 USAID-funded projects, which are FHI 360 and Achieving Health Nigeria Initiative. In the subsequent couple of years, she was the World Health Organization consultant for the measles campaign and outbreak response in Nigeria. She's an innovative person who is very keen on making an impact and is always working, willing to learn new things. As such, she's the WHO Scholar Nigeria Alumni Coordinator, and she also serves as a peer advisor to the BLN Network. Gift holds a master's degree in public health and is currently a doctorate research fellow in the public health at the University of Calabar in Nigeria. Welcome, Mrs. Aniom, and welcome to the speakers. I will now give the floor to the moderator to introduce the speakers and also lead us through the discussions. Madam Moderator.
Good afternoon, Madam Catherine. Good afternoon, everybody. Thank you for joining. Thank you for joining us in this section. It promised to be very exciting and you learn so much. So don't go away and just sit tight. Where you have your questions, just hold on to the end of the discussion. We will give room for people to ask questions. So I want to quickly call on, since there's a slight change in the speaker, especially from the person from Zambia, I would like to give the room to Mrs. Josephine to just do a quick introduction of herself and just maybe 1 minute so we can go ahead. Then I also call on Dr. Mike Chisima to also give a quick introduction of himself before we go ahead. Please, Mrs. Josephine. Hello, can you hear me?
Yes, we can hear you, Gift. We can hear you. Mrs. Simwinga?
Hello?
Okay. Yes, we can hear you.
Okay, fine. Good afternoon, Gift.
Good afternoon, ma'am. Welcome.
Okay, fine. Good afternoon, everyone.
Go ahead, ma'am.
Okay, I'm Josephine Simwinga, Chief EPI Officer in Zambia, under the Department of Public Health. I'm a deputy to Dr. Mwansa. Unfortunately, Dr. Mwansa is not around this afternoon to be with us. I'm sitting in for him. I've been with the program since 2008. I'm sure you can guess, all of you, how many years I've worked in the EPI program. I hope I should be able to share a few experiences.
No, so much.
I think that's all I have to say about my. I'm also a, yes, please.
Okay. You're welcome. You have a lot to share with us today from your experience.
I hope so.
No, we know you have. So we'll call on Dr. Mike Chisima to also do a brief introduction, so we can go ahead.
Thank you very much. I hope you can hear me.
Yes.
All right. This is Mike Chisima, about 38 years old now, married, 2 kids. My practice started a long time ago. I'm almost 15 years in the service. Started 2006, and I've worked before as a community health worker, which is, in our case, I was assistant environmental health officer, looking after health surveillance assistants, in our case, vaccinators. A total of 150 of them, about 120, 150 of them, several health facilities which I was looking after. And thereafter, I joined the medical practice, doing Bachelor of Medicine, Bachelor of Surgery, right here in Malawi. Then we worked as an intern medical officer at one of our tertiary hospitals, and later moved to the district about 6 years ago. I've worked as chief medical officer. I've also worked as Director of Health and Social Services in the district before I moved to join the API family as Expanded Program on Immunization National Manager, which I'm currently holding the position now for the past 8 months or so. I'm not very new to EPI. However, at leadership level, I would say quite new because I'm quite specific now, unlike when I was a jack of all trades as Director of Health and Social Services. Thank you very much.
Okay. Thank you very much, Dr. Mike. You are not new to EPI, and all your wealth of experience, if you provide it, you know you will do so much. You have so much to share. So, once again, thank you, and welcome everyone for this meeting. It's going to be very, very, how would I say, you're going to learn so much from me. So just relax, like I said before. And so we just have some few questions for the speakers. Based on their experience, they have so much to share with us. COVID-19 is actually a new disease that is on ground, but we are going to be looking at it, how we can tackle the COVID-19, what has been happening in our different countries, how it has affected immunization system to some countries because of some rules, some lockdown rules. Don't do this, use face masks, wash your hands and all that. You know, many things has been affected. In fact, lockdown, shutdown of some countries, many economies have been shut down, including immunization activities. I think we have gotten some side effects, some negative effects, also some positive effects, because some people, some countries have been able to overcome it. They've been able to put up some strategies to make sure that they recover fast from the impact of COVID-19. And so I'll go ahead with the questions I have for the two speakers. One of it is, I want to call on Mrs. Josephine, just to tell us some of the challenges that they are facing at the national level, how it has affected the immunization system, how COVID-19 has affected the immunization system in their country, in Zambia. So, Mrs. Josephine, can you hear me?
Yes, please.
So, my question is that, please, what are the challenges that you are faced by, that the national immunization system is faced in your country as a result of the COVID-19 pandemic?
Moderator, thank you very much. COVID-19 is new to all of us, Zambia inclusive. And I'm sure some of the challenges that we are facing could also be faced by other countries. And actually, I hope as Zambia will have to learn a lot from what others are also doing. But we've actually faced quite a number of challenges, and these actually started with disruption in our plans. Disruption in our plans, which included even shipment of vaccines. And as we may all know, what does that entail? We are looking at maybe future stockouts or even stockouts in other districts that might not have enough stocks. The other thing is there's been quite a lot of uncertainties within the program itself, because we don't know when COVID is going to end. And we don't know what tomorrow holds for us, whether it will be another wave or maybe we'll be streaming down. So these are some of the issues that we are also grappling with in the program. And unfortunately for Zambia, we are coming from a scenario where we had a bit of insecurities, in that there was this rumor of gassing and the rest. So when you're just trying to pick up and try to see how we would intensify some of our immunization strategies, we had our first case of COVID, because our first case of COVID was in March. So you can all see what challenges the program has to go through in order to put back the program on track. And we also were coming from issues of our rainy season. During that period, some of our districts or some of the areas are cut off. So immunization services slowed down. And during this period, this is when we hope to catch up by intensifying a lot of our outreach activities and other activities that would put us on track. But unfortunately, we're just trying to recover, and then we are into the COVID time. There was also an issue of reallocation of staff to COVID fight. In Zambia, most of our injectable vaccines, actually all our injectable vaccines, are given by trained staff. So some of this staff had to also respond to the COVID outbreak. So this meant that we had to do with the staff that we had. In other places, we also have very limited space in our health facilities. COVID comes with a message of social distancing. So how do we manage that? Though it's at facility level, but even at national level, we're getting a lot of concerns from the lower levels. And unfortunately, Zambia wasn't also spared from the myths of the COVID-19 vaccine. So even vaccines, in a way, according to anecdotal information, is viewed as maybe a COVID vaccine. We're just coming from our HPV dose 1 and dose 2 implementation. At the same time, we're also doing our IPV catch-up. So you know what that meant. And for the HPV vaccine, we're looking at girls, teenagers. And here we are with these rumors of COVID-19 vaccine. Then the other thing is, we've also noticed during our supervision that we are having challenges of adhering to COVID-19 guidelines because of these high volume facilities. And we have quite a number of communities that maybe would want to bring their children for services, and yet we do not have enough space, as we are saying. So for us, it became quite a challenge in terms of adhering strictly to social distancing. These are the few challenges that, among the many that I've shared with you.
Thank you very much, Madam Josephine. I appreciate you sharing your challenges with us. These challenges are not so different from what is happening in other countries, and including Nigeria here. I don't know if Dr. Mike have a different thing to share with us, or if it's similar to what is going on in Zambia and other parts of the country. Dr. Mike, do you have any different challenges you are facing in your country? Dr. Mike, can you hear me? Hello, Dr. Mike. Hello. Can you hear me, Dr. Mike? Okay. we'll still
Hello?
we'll still go ahead. Okay,
Hello?
we can hear you now. We can
All
hear
right.
you.
Okay, thank you very much. The challenges, I think, just as my colleague has said from Zambia, that the COVID-19 is quite new, but also there are so many things that are happening and people are still learning along the way whilst trying to manage the pandemic itself. So the challenges are expected to be very much similar, and Africa is not much different. However, I think I still need to put some highlights. Some could be exactly just as Zambia is experiencing. But the obvious challenges are there's really an obvious cut down of program activities, and that is routine immunization in general. There's a lot of cancellation of clinics. We used to be somewhere around 2-3%, but now we've moved to as much as 4%, in some places even 5%. That is on average, but we could have others that are extreme in some places, depending on the availability of PPEs and all this other stuff. There's also a challenge in availability of immunization officers in some places, because people are now busy task shifting, doing contact tracing and all that, because we rely so much on community health workers in our case. It was different when the cases were very few, but right now I think we are on a trajectory, almost 60 cases each day going up for the past 3 weeks, and there's likelihood to have an obvious effect on that. Another challenge is partner availability. We used to meet physically, do certain things together, plan together, different meetings. We had to learn the hard way to use the virtual meetings, but still more we may want to do other things that are partner related, be it finance, where signatories and all that have to be met physically. But most of them have office kind of lockdowns, so they are not as available. So our team has been becoming smaller and smaller each passing day. It's the main focus is usually the team, the EPI team only, than we used to be as a huge family. And we noticed this more of WHO and UNICEF staff in our case as our key partners, apart from PATH, who also have their staff.
Sorry, Dr. Mike, can you increase your volume? You seem to, it's not clear. So please.
All right. Am I audible enough?
Yes.
Okay. The other challenge that we have is the district challenges, especially availability of personal protective equipment. I think we've had challenges. By the time the pandemic was almost hitting our country, most of the countries around us were already on lockdown, and Malawi is a landlocked country. We could hardly access these PPEs, and we have very few manufacturing industries specialized in these areas. So it was difficult even to mobilize locally. So the PPEs were not made available for community health workers more than they would have for clinical staff like nurses and clinicians in the hospitals. So that was a huge challenge, and also some strikes that also have in some cities that came with it, because people were demanding allowances and all that for the risk. Of course, our risk allowances used to be very low, but I'm happy to say now that the government was able to bring that on board, and it's no longer an issue. But that was also challenging in the way people were executing the services. Was apart from taking care of the services, but they also needed to take care of themselves. We also had a challenge with the political landscape. I think you are all aware. We just went through an election recently. But I think for the past 2 years, Malawi has been struggling. I think we are happy to say now that there's so much peace that's kind of settling. But also, I think you can already see the rise in the COVID-19 cases in our country for the past 3-4 weeks. Different from what used to be when we had the first case in March. I mean, on 2nd of April. However, Malawi was declared a state of disaster by 20th of March. So we are 3 months challenged to see most of these things. So it's really a turbulent sort of environment which we are trading through. But I think we just have to make do with it. Thank you.
Okay. Thank you very much, Dr. Mike. We'll go on quickly because we don't want to run out of time. Many countries have been able to develop some strategies so as they will not be so much affected in terms of this COVID-19. Their immunization system will not be so much affected in terms of their supply chains, their service delivery, their demand creation, their human resources, because most human resources now have been converted to COVID-19 team. And so some of the health facility, especially the PAC, may be suffering from staffing, and then and some supply chain because of this lockdown. Thank God that the lockdown has been carried out, have been removed from some countries, and so it gives access to some other countries. So, but I also want to ask another question. So, what are the strategies that Zambia, you've been able to, some strategies or some lessons you have learned from other countries that you have been able to implement to improve the immunization services delivery during this COVID-19? What are those strategies? So as maybe we can learn from you also, and then we can also improve in our own site. So, Madam Josephine.
Thank you, moderator. Some of the strategies that actually have been implemented in the country include not only the EPI program. We've been quite happy. The government has recruited quite a number of health workers to try and mitigate the shortage that was coming on board. So for that, for us, that was a relief. And we also had guidelines developed quickly and shared with the lower levels. And these guidelines included guidance on increasing immunization service delivery, multiple service points, and also extended service hours for those facilities that could manage. The government also distributed PPEs to health workers, even hand washing facilities and sanitizers. This would help in actually making sure that the services go on in the midst of this COVID outbreak. And what also helped for us was the national television updates on COVID-19. And actually our Minister of Health, it played a very big role because it also built confidence in the public, in that they would always listen to how the pandemic was evolving. And the emphasis was also even on the provision of other services, including immunizations. One other thing that we're quite happy about was the designation of quarantine centers. Because, you know, from the beginning, everyone thought health facilities were a risk area or a no-go area. But once the masses heard that we had specific areas designated to look after COVID cases, at least it enabled some of our clients to access our immunization services. And I think the other thing is we also have a task force that has been created to strictly oversee the COVID activities. This actually gave a relief to other program officers to concentrate on our core business. That includes immunizations. And we're quite happy in that we had already planned to conduct a IPV catch-up. So during that period, we also used it to strengthen and catch up on missed opportunities. And we also make sure that even the children who were due for any routine services for that week had to be captured. So this strategy also had to be integrated with our Child Health Week implementation time. We're hoping by doing that, we can also try to integrate even with these other services so that immunizations are not given in silos. We've always used volunteers in Zambia, but this time around during the COVID time, I think we've realized that they actually add so much value because these are the people who've been living in these communities. And with the correct messages, they've been able actually to inform the masses on the importance of immunization despite the COVID-19. Because in that, it was even easy for us to talk about a door-to-door, which is very difficult. But if you have volunteers who are coming from those specific areas, they were able to disseminate information for us. And we've also enhanced our stock monitoring so as to ensure visibility. And we are doing this so that in case there are districts that might have stock out, we should be able to react in the shortest time possible and redistribute vaccines to those districts. So what is happening currently is our national level logisticians are actually using our already existing platform, which is the Logistimo, to try and engage, they're actually engaging the districts and provinces on a daily basis. And in addition to that, we are also using other platforms such as WhatsApp to try and monitor our vaccine stocks at lower levels. And we've also encouraged even lower levels to come and pick vaccines, and where they have to wait and wait for the national level of our distributions. The other strategies that we are actually using is we know we could not meet physically, but despite the time when we had a few people working from home, we'll still continue our services, still continue our meetings using the visual meetings. So I think for Zambia, these are some of the few strategies that we are actually implementing.
Okay. Thank you very much for that quick response. But I still have small concern. My concern is even though there is volunteers that are going house to house to help to inform mothers about the need for still continuous immunization, how has the turn-up been? Since is there a decrease? Because in some countries we have decrease in immunization, turnout of parents, mothers to immunization activities, services, and it makes our coverage to be reduced. And so I don't know what is actually happening in Zambia despite all the strategies you have put in place, whether we still have more turnout of parents coming to their children to be immunized, or they're afraid, or it's just the house-to-house that you're doing for now, or you are still having outreach section or increase in sections in the facility. So can you elaborate more on that aspect?
First and foremost, I want to correct the impression. The door-to-door that we are doing is not door-to-door immunizations. The door-to-door that we are doing is we are taking advantage of the volunteers coming from their respective sections to try and disseminate information for us that immunization services are still ongoing despite the COVID pandemic. For outreach, the message has been to them that the message to the lower levels has been that we intensify outreach, and outreach has continued despite this time. All we actually requested was for them to increase outreach sessions so as to avoid overcrowding. And all this was embedded in our guidelines. Even at facility level, we had requested the facilities to increase the session times and also to even increase the session hours so as to give an opportunity for more clients to come to the facilities. In terms of seeing reduced numbers, we are yet to do a study on that, but maybe just sharing the experiences that we had during the catch-up. In high volume facilities, we still saw huge numbers. And this is where I was saying it was even sometimes, if they didn't plan so well, it became overwhelming on the health workers.
Okay, thank you very much. Thank you for that's a different case in what we have in our country. But however, I'm still going to call on Dr. Mike Chisima to say some of the strategies. I don't know whether they have the different strategies they have put in place, and some lessons they have learned from other countries that have also helped also to improve their country immunization services. Just as you say that the volunteer also helps to make mothers still know that there is still immunization services ongoing. So, Dr. Mike, do you have anything different from what Madam Josephine had just said?
Okay, thank you. Hello, everyone. In Malawi, of course, we may have a few differences, but generally, I think our approach is not far much different. Our focus mainly had been on continuing with the services. Initially, we had a different plan because of the landscape of things. We had very huge challenges with the availability of PPEs, such that we were even risking almost stopping the immunizations for a short while, maybe 3 weeks or so. But I think along the way, people were able to sit down and pull each other up, and then quickly that was never implemented, and we chose the best way, that is to continue with the services. Of course, it was an issue of trying to balance the need for the PPEs with the active health workers that is necessary clinicians, unlike community health workers, which we had to lobby that please, you also need to consider the health workers that are existing in our communities. So we agreed and moved on, never to halt immunization services. But one good thing that came with that is the now partners rushed in, supported everything. Gavi, the part and parcel of the people that draw some money to support some of the infrastructure development along with it, and also lobbying the government to continue providing EPI services along the way. I will mention a number of things, but I will not be like explaining each one of them unless somebody will have a question. But I have about 9 items or so, if not 8 items that are part and parcel of the strategies.
Don't mention all of them, but just mention the most strategic ones so we can.
I'll not take a lot of time. I will not take a lot of time. Yeah, I'll just be mentioning them. So as government, we were able to run through and employ about 600 officers. Of course, some are not yet deployed. That is health surveillance assistance with support from partners, but also country basket, 600 health surveillance assistants. We had stakeholder mobilizations to support EPI by providing PPEs. UNICEF is part and parcel of that, but also other stakeholders that are supporting on that. We also developed standard operating procedures on what needs to be done on a site where we are providing immunization. So we had a documented SOP, just a page that we distributed to all vaccination points. We also had a collective and integrated approach to activities, different departments, but also stakeholders. We were able to come together and map a way forward on how best we can be putting up things together as a team, but also the district approaches in training. They also make sure that they are integrated to train the people around COVID. We also continued with some trainings, but also supervisory work, just aligning them with COVID. Among others, we managed to do the vaccine management training, which we are continuing, just to make sure that people are strong on supply chain systems and cold chain systems, even during this time, knowing that the global supply is affected. But also went ahead to do some micro planning, which I think they will support us now, but also they'll support us even post-COVID as part of revitalizing it. We are still under discussion with the UNICEF for a technical assistance so that we can already start to plan on how best to come back and how best to restructure EPI post-COVID, even during the COVID as the pandemic evolves. Lastly, we managed to have a distant or a wireless national vaccine store cold chain monitoring. So somebody, because of issues of distance, but also reduction of the personnel coming to work, at least one is able to sit at home and check what's happening with our vaccine stores, despite having one physical available. The last one is we want to continue supporting the districts with the resources for supply chain management. So we want to provide them with fuel and allowances so that they can come collect the vaccines and collect everything, but also be able to distribute from our end, knowing that the districts are overburdened. Thank you.
Okay, thank you very much, Dr. Mike. So much have been done already to see how you can overcome the menace of the pandemic. So I also want to ask, in nearest future, how do you foresee the impact of this COVID-19 on your immunization system, especially in terms of coverage and equity? So let me start with you, Dr. Mike. In nearest future, how do you foresee the impact of COVID-19 on your immunization coverage and equity?
To be realistic, I hope you can hear me.
Yes.
To be as realistic as possible, there will be so much impact anticipated. One big impact which we are very worried, and that's what we are trying to push on, is maybe ensuring that we still maintain the coverage levels of our routine immunization things. However, COVID is one general issue. It's not only being spoken of in one area. So sometimes also we want to do our best, but what others might also be doing has a likelihood to affect whatever interventions we may make from our end. But I think what may be important is just to already start thinking, how are we going to capture, let's say, children that seemingly did not receive the vaccine when they were due for that. So we're already working on issues of micro plans. These are some of the plans which we already had, but I think we're intensifying them now, that we want to make sure that the micro plans are there. At the same time, if we have cancellation of clinics, people have to document which clinics, how many, and which children might have been missed, so that we have some kind of customized or kind of specific activities just to reach out to those particular pockets. But I know it won't be easy, and probably it might also be too early to preempt some of these things, because in our case, cases are just going up now. We have not yet reached our plateau phase. So certainly some things will still have to change, but we are planning other things.
Okay, thank you very much, Dr. Mike. Madam Josephine, do you have a different thoughts towards the impact of COVID-19?
No, not really, but maybe just one addition for us. Our fear is not only are we afraid of coverage going down, but we're also afraid of disease outbreaks. We do not want a situation where we again go into seeing a polio case in Zambia. So actually we are working hard to try and strengthen routine. Right now as a program, we are developing proposals to try and source for funding to see how would help those districts that are along the high risk areas and those districts that are already low performing in immunization, so that they don't actually dwindle or go down completely because the issue is, like Malawi has said, we don't know. I think I did mention in the beginning, but there's a lot of uncertainty for us where we're going to. So the route that we are taking is just to strengthen routine.
Okay, thank you very much, Dr. Mike and Madam Josephine. I also want the participants to type in their questions. Where you have some questions, to make some clarification from our speakers, do type in so as you don't forget, so as we can come back to it when in the next 5 minutes. So I just have 2 more questions for you.
Hello, Gift. Hello, Gift.
Yes,
Gift?
yes. Can you? Yes, I'm hearing you.
Yes, for 10 seconds, I think I needed to mention that on disease surveillance is also another critical issue, just as my colleague has said. But surveillance is also to turn it into some kind of virtual or using other modalities of trying to make sure that there's still active case finding, even using the other platforms, WhatsApp, emails, and all that, and then a few follow-ups. with our colleagues. So we are waiting with WHO to come up with that. We learned it from, I think, Nigeria or Tanzania. They are doing something similar. So we are trying to borrow that particular platform so that disease surveillance also is strengthened. Thank you.
Okay, thank you. So, with one more questions, what I want to ask is that what should we do to improve the resilience of this immunization program and health system in general to better cope with the disease outbreak in future? Because we know that we are not ignorant to the fact that disease outbreak may come up. So, but what should we do so as to improve the resilience of the immunization program and health systems in general, so as to help the country, help in Malawi and Zambia and other countries to be able to cope with the disease outbreak in future? So I'll call on Madam Josephine, that please don't take much time, just take some few minutes so as we can round up this and give the floor to participants that may have questions. Please.
Generally, generally, I think the COVID pandemic has taught us a lot. And for Zambia, we are learning to live in the new normal. So I think this is a term that we should use even in the frequent outbreaks that are coming so that we avoid disruption of services. And then we need to also strengthen and embrace the local partnerships, because in this time of COVID, it taught us that even local partnerships actually came on board quite early and carried the program up to where we are now. And resource mobilization is something that has to be continuous. So we also need to strengthen integration so as to leverage resources within programs and even within other programs in the department or outside the department, so that we see how we can integrate services that can be conducted at the same time. Data is also important so that we could monitor the unvaccinated children and have targeted interventions for those ones. You know, in this time, resources are also meager, so we also need to prioritize. So this is where we need to strengthen our data analysis so that we can target our interventions to the children that have been missed or unvaccinated. And I think the other thing is we also need to strengthen regional networks, just like we are doing, so that we learn a lot from each other. Even in times of where you are foreseeing maybe a stock out, if we could within the region itself, for instance, Southern region, so that we could mobilize stocks within ourselves for those countries that still can have stocks to share with other countries. I think this is the few that I could share.
Thank you very much. Thank you. That strategy is very, very timely, especially sharing resources with other countries, especially those within the region. It's very timely. So, Dr. Mike, do you have anything different from what she has just said concerning how to improve the resilience of immunization program and health system in general?
I think in general is to make sure that we, as EPI, in this case Malawi, we still need to be strong as a family, regardless of the challenges that we are all facing and going through. The relationship that has always existed when there was no COVID, I think needs to be strengthened. We just have to find better ways or improved ways of how to talk to each other, how to communicate with each other, and make sure that things are really functional and they're still making sense even in times like this. Otherwise, the challenge is if one decides to pull out, or if one decides to say, I'm going to function when things come back to settle and all that, then we are challenged. We want to see our partners like UNICEF still being strong and strong even this time around to ensure that the supply chain system is strong and up to date and very well strengthened even in times like this. We want to see our technical supports that we have from, let's say, PATH, technical support we have from WHO. It has to be strong even in times like this. Yes, they are not meeting in their offices this time around because of issues of physical distancing, but it's important that wherever they may be, they still have to find ways and means to still provide the same support they could have provided in times when there was no COVID. If there is COVID, but they just have to make an improved one so that we still maintain the robustness of our programs and prevent the diseases. But minus that, then the programs are hugely challenged because we depend on government, but government can hardly collect taxes this time around. Revenues are very low. We do not expect much. So we rely so much on teamwork so that resources can actually be well balanced and shared complementary. Thank you.
Okay. Thank you very much for these insights you have given to us. One of the ways you have said we can do to improve our resilience of immunization, we have said support from in-country partners, strengthen and embrace local partner resource mobilization, integration of programs, which are very, very important because this is not the time to say, oh no, I'm of malaria program, I am of HIV program. It's a time to work in synergy, in work as a team, integrating our work so as we have results that we needed, not that different programs are working in a different way. So thank you very much. We just have 9 more minutes. So I'm going to give the floor to people who have different thoughts or who can share some of what is happening in their own context to us, and then I'll come back to you, to the speakers. So the floor is open. If you have questions, you can raise your hands. If you have a thought to share, you can raise your hands so as we call on you. But there's one question here. Has either country increased the number of sections per section per week so as to diminish the crowding in each section? Do you use 10 dose or 5 dose of MCV? Yes. So this question is to the speaker. And any other person can answer it, please. So the floor is open. Those questions of yours you want to ask, please ask them.
Madam Moderator, there's a hand up from Adelaide Shirley.
Okay.
Okay. We've just unmuted her. Shirley, Adelaide, you can go ahead.
Hello, can you hear?
Yes, louder.
Yeah, okay. Thank you very much for from Zambia and Malawi for sharing their challenges and strategies. I just wanted to find out from the 2 countries whether they had to reprogram some other activities towards, towards to activities to deal with the pandemic, because I think some countries have had to, who have the HSS funds from Gavi, they had to now reprogram to cope, with the pandemic. And also now the issue is that there are no additional funds now to go back and implement the original plans. So I just want to find out from the 2 countries whether they had to reprogram any resources to cope with the pandemic. Thank you.
Okay. Thank you, ma'am. Please, the question is to the speakers. You can go ahead. Any of you can unmute yourself.
Thank you very much. This is Mike. Yes, our HSS resources were reprogrammed about $4.95 million US to support COVID. But I think one important thing that we had, which seemed to have cushioned us, we had a lot of resources remaining in the part of 2 years of the HSS grant. So I think it was quite easier for us to, for Gavi to actually pick what was more or less like looking at surplus. So it didn't really affect our general output in the HSS programs or projects. But maybe we'll see what will happen post-COVID on how best they're going to reconcile the HSS. Otherwise, yes, we managed to provide that through Gavi. Thank you.
Yes.
Okay.
For Zambia, we are actually in the process of reprogramming about, I think, 10% of our Gavi HSS. This is when we are just trying to do a concept note and a proposal to see how we would access those funds. But so far, I think we did manage to conduct our activities within the resources that were available. We had certain activities that we planned, and those were major activities that we couldn't reprogram. And one of them was the IPV catch-up. So at least the funds that we got for the activity helped to also cushion this time around. And Zambia was just coming from the MOPV supplementation. So some of the structures are already in place, because I think we do recall at the time when we had the first COVID outbreak, teams still integrated activities that had to do with COVID and immunization, especially in terms of messaging.
Okay. There's a question here.
A quick question to my colleague as well, if you may allow me.
Yes, please.
Yeah, a quick one. Zambia. For Malawi, I think the HSS money just went into the COVID pool and supported the epidemiology COVID pool, but we never used the funds as EPI, trying to put some of the strategies within EPI and we implement them as such. No. And actually said Gavi actually told us that the money has been supported, has been given the other side to do everything. They can't provide the other monies. Of course, UNICEF is partly doing that. I don't know how you maneuvered to have the money be used by EPI as a program. Did it work like that? We never used the money.
I think I did mention that we are yet to reprogram Gavi HSS money, and that money will go into a pool, the COVID pool. We've not yet, yes, we've not yet accessed that money. This is when we are doing our proposal and concept note to Gavi.
Okay, great. Thank you.
Okay, thank you very much. We are learning from each other. There's a question from Bai here. It says, how has the pandemic affected the HPV vaccination, and what are the plans to mitigate the challenges? So, has the pandemic affected the HPV vaccination in your country?
In our case, I think, hello?
Go ahead, sir.
Yeah, in our case, I think we have not yet routinized the HPV. We're just coming from a second dose and the first dose to others, like a second sort of campaign that took place in January. So that was before COVID. So I wouldn't say we can say much about the effect, but maybe the plan that we have to introduce it into routine immunization, probably we may need to see where to push the schedule. So maybe not at the moment.
I think ours is similar to Malawi. The only difference is we are just coming from our implementation of the HPV vaccine, that is some 2 weeks ago. So I think we still need, we are yet to see the impact because we are still analyzing our data.
Okay, thank you. I don't know if there's another question. I have one question for the speakers. My concern has been to mothers coming to the health facility to immunize their children. Is there any specific testing centers, or do the health facilities, do they have testing centers to enable the mothers to be tested of COVID-19 before immunizing their children? Is there any testing centers attached to the health facility so as to help also to ensure that we prevent or we cut down the spread of COVID-19 in your countries? I don't know, Madam.
A person.
Okay.
I missed the question.
My question is, are there testing centers or are there testing kits that is being given to the health facility, especially the primary health care centers, that so that when mothers come with their children to immunize, they will first of all test them of COVID-19 before administering immunization to their children or to them. So is there any provision for such? Did you get my question?
As for Malawi, we haven't.
Okay.
Yes, as for Malawi, we haven't gone into universal testing. We are testing only those that seem to be showing signs, but also those that are contacts. So we are not testing everyone. So no need for that.
It's similar for Zambia. I think we haven't gone that way.
Okay.
We'll have to learn from other countries that are doing it, how feasible it is in terms of resources, both human resource and even the testing kits. How are they managing?
Okay. So, thank you very much.
But screening is happening.
Screening is happening, yes.
Okay, screening is happening, but the testing is not going on. Okay, okay. So we hope that in nearest future, Zambia and Malawi will come up with a study so as to help us to actually know the impact of the COVID-19, how it has really affected the immunization system. So as we will not be talking just based on what we have seen, but based on epidemiological studies that that have taken place to understand the impact of this COVID-19 on the immunization system. So we have passed our time. We thank the speakers for coming, and we appreciate you and the participants also who have stayed up to this time to listen, to learn. We appreciate you for coming. We know that we have very much exciting sections in the coming week, and also in when we shall share what we have found out as a result of COVID-19. But someone have a question. Okay, so we have tried to develop an SOP which address this, but the extent of practice is yet to be checked. Okay, thank you, Dr. Mike. So I'm going to just give the floor to Madam Catherine, our host. So as we round up this section, we don't want to take more of your time. Thank you very much for listening and giving us the floor. Thank you, Madam Catherine. Over to you.
Thank you so much to you, Madam Moderator. I think you drove the discussions very well, very engaging and very lively. Would like to thank you, the speakers as well, for sharing their country experiences on how they've been delivering their immunization services amidst the COVID-19 pandemic. And I would also like to thank you, our dear audience, for your active participation, for the questions that were coming in, and making the discussions very lively. And just to mention that this webinar has been recorded, and we'll be sharing the recording link so that you could access it. And also just to mention that we'll be sharing the recording for the last one as well soon after this webinar. And just to mention that please feel free, after you've taken your time and listened to the recording, and you've got any questions, you need any clarifications, or you've got any comments for our speakers, please feel free to communicate on our discussion group. That is through the BID Initiative Google Groups, where you can just type in your comments and whatever questions. I'm sure the speakers will be more than willing to respond to those questions. Would like to ask all of you to continue connecting with us as a BID Learning Network. This is your platform where you can share information, share experiences and everything on those different platforms that you have. They're the social media platforms, the Facebook, Twitter, the blogs, as well as the website and the Google Groups. So until next week, Thursday, please continue trying to keep safe. Mask up and make sure you sanitize your hands, and or wash them thoroughly so that we stay COVID-free. And just to mention that next week we'll be listening to the sub-national levels. We've heard in the last two panel discussions, this was at national level, got to hear how they've been coping with the COVID-19 pandemic as they deliver the immunization services. This time, we'll be listening to the sub-national levels. Let's hear what the communities have to say. Until then, thank you so much. Till next time, bye.
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 Bye.